This is Grace with Graceful Living.
Seems like COVID is getting a little bit better due to the vaccine in the last few months. However, it's still not over, and it may become endemic in our population. So I wanted to do a little piece on risk factors for severe COVID and what you can do about them.
This is a list of risk factors on the CDC website. Going through the list, there are some things you can definitely do something about preventing, but not much to do if you already have the disease. There are some things that you are simply born with, like sickle cell disease, so there's not much to do about that. Here are some other possible risk factors, including high blood pressure, liver disease, and being overweight, among others. In this video, I'd like to concentrate on risk factors that you can change, like hypertension, obesity, smoking. You can change your lifestyle and reduce your risk factors for COVID. Stop smoking and try to eat healthier. As you can see, lots of these risk factors for severe COVID are part of metabolic syndrome, which I've talked about before and which is preventable. So to be diagnosed with metabolic syndrome, you have to have at least 3 metabolic risk factors. They include a large waistline or abdominal obesity, a high triglyceride level or being on medications to treat a high triglyceride level, a low HDL cholesterol level. HDL is called the good kind of cholesterol, and having a low HDL cholesterol can make you at increased risk for heart disease. Also a high blood sugar, or being on medication to treat high blood sugar and high blood pressure, and that also includes being on medication for high blood pressure. This is a review article that looked at the risk factors for severe COVID. They looked at many different studies, and they found that certain risk factors were more prevalent in patients with severe COVID. Male sex was more likely, obviously an elderly age, also being obese, having heart disease or other comorbidities, and having diabetes seem to be risk factors. So I was saying before, in regards to metabolic syndrome, obesity seems to be, or more particularly abdominal obesity, seems to be a big risk factor in metabolic problems such as diabetes, hypertension, and it also is a huge problem in COVID. This is a study which analyzed multiple different studies and showed that obesity increased your risk for more severe COVID. Well, you're probably thinking, why might this be? I mean, you know that obesity increases your risk factor for these other metabolic diseases such as hypertension, high cholesterol, heart disease, diabetes, and whatnot. But what are the other reasons why obesity could be a risk factor in severe COVID? This review article goes over some of the reasons that they think that obesity is a risk factor for severe COVID. Here is a diagram that shows all the things that they mention in the article. First off, people who are obese have impairment of their respiratory function through a few mechanisms, such as restriction of their lung volume due to surrounding fat. There are other challenges, such as turning patients who might be heavier and more difficult to turn if they are heavier, and also adequately ventilating them may be difficult. There's also evidence that people who are obese may have more dysfunction of their blood vessels or the coat inside their blood vessels, which may contribute to more problems as well. There's more dysfunction of inflammatory mediators as well as increased likelihood for clotting, which contributed to a lot of the mortality in COVID patients. Obesity also is associated with alterations in the function of your endocrine or hormone system. As you can see, this is the case with diabetes. There also may be a component of immune dysfunction, as people who are obese are also more likely to suffer worse consequences of the flu and other common respiratory viruses. In conclusion, the authors encourage that weight loss be emphasized because it could improve outcomes for COVID and many other diseases. I did like the fact that they suggested nutritional improvements. So what can we do to lose weight and get rid of some of these risk factors we have for COVID? This is a review article published from the researchers at the Physicians Committee for Responsible Medicine. They talk about how plant-based diets can reduce chronic disease. Plant-based diets reduce the risk for heart disease. They also reduce the risk for metabolic syndrome and encourage weight loss. Plant-based diets can improve glycemic control, also high blood pressure and high cholesterol. So if you're suffering from any of these chronic medical problems, it's a new year, so make a resolution and go on a plant-based diet. It's going to protect you from COVID and many other diseases. If you like this video, please give me a thumbs up and subscribe, or follow me on Instagram. Please go to graceandhawaii.com for more information.